Walker, it's Amanda Pace. I'm going to be the PA student here today with Dr. A. Is it okay if I call you Miss Walker, or do you go by something else?
You can call me Lauren.
Lauren? Okay. All right, Lauren. So what brings you in today?
My eyes, they're just really red and irritated.
And can you tell me a little more about that?
They just really hurt, and I noticed them being like really red,
Okay.
and they're like itchy.
Okay.
And I haven't been able to get, they've been like this for a while.
Okay. How long would you say?
Well, I mean, it's been days, like 3 days.
3
It feels like forever.
Okay. And can you tell me a little bit more about like the pain of it?
Yeah, it's like burning,
Burning.
and like they get really watery.
Okay.
I don't know I don't know what caused it, but it really hurts.
Okay. So yeah, back to what were you doing? Was there anything you were doing differently about 3 days ago?
I mean, I had just come back from the beach.
The beach.
Yeah.
Okay. And is it just in your eye, or is it going anywhere else?
No, it's just my eyes.
Okay.
Like when I itch them, my like skin under my eyes hurts, but I think that's just from itching.
Okay. And do you wear contact lenses?
Yes.
Yes, you do. And is there any discharge coming out of your eyes besides the tears?
I mean, I'll have like crust
Okay.
when I wake up in the morning.
All right. And have you been exposed to any extra UV light, or is it just the sun from the beach?
It's just the sun.
Okay. All right. And about this, have you tried anything to try to make it a little better?
I've tried like over-the-counter drops.
Okay.
Because I thought maybe sand got in my eye, but
Okay.
those didn't really help. And I have this like night cream that I put in my eyes when I go to bed, but that didn't help either.
Okay. Is there anything that's made it worse?
Yeah, when I sleep, like when I sleep, it really bothers me.
Okay. Okay. And with the pain of it, what would you rank that? If 0 is no pain at all and 10 is the worst pain you've ever had, where would you rank it on that scale for the eye pain?
I mean, it's probably like a 6. Like
6.
It hurts, but
Okay. And has the pain been there all 3 days as well?
yeah.
Okay. Okay. And are there any other symptoms coming along with this? Any congestion at all? No? Sore throat? Nothing? Okay. All right. So I do have, you're coming in here today, you've had about 3 or 4 days of red eyes, and it's come along with some itchiness, some painful burning sensation. You said that they're really red, and you went to the beach right before this, and so there's a chance that there could have been sand in your eyes, but you said you've tried a couple of over-the-counter drugs or eye drops to try to make it better, but they really haven't helped that much. You said when you're sleeping that it's worse, so hopefully we can come to the bottom of this, because a 6 out of 10 is a little too uncomfortable. So hopefully we can get a better understanding of this. So now I'm going to go ahead and shift into some past medical history, see what you've had up until this point. So first of all, have you ever had surgery?
No.
No? And so have you ever been hospitalized?
When I had one of my children.
Okay. And when was this?
5 years ago.
5 years ago? And what happened to make you be hospitalized?
I had a C-section.
A C-section? Okay. All right. And everything with that healed up properly? No infections of any sort? Okay. And are you allergic to any medications?
No.
And do you take any medication regularly?
I mean, I take Claritin because I have like seasonal allergies,
Okay.
and I have a birth control that I'm on.
Okay.
Other than that, nothing else.
And with the seasonal allergies, is it worse in a specific season? And what season is that?
Yeah, it's probably around like, end of fall, early winter.
Okay. So about this time?
Yeah.
Okay. All right. Have you had any traumas of any sort? Any sprains, strains, concussions, or traveled recently?
No.
Okay. And how many pregnancies have you had?
2,
2?
but I've only had 1 kid.
1 kid. Okay. And can you tell me a little bit what happened with that other pregnancy?
Yeah, I just had a miscarriage at like 3 months.
Okay. Sorry about that. Alrighty. And when was your last yearly exam?
It was probably like 6 months ago.
Okay, good, awesome. And did you have any childhood illnesses of any kind? No. And are you all up to date with your immunizations?
Yes.
Yes. When was your last flu shot?
Oh, That might be like 2 years ago.
Okay. So we do recommend to go ahead and get the flu shot every year because the virus does change and new strains come out. Just to protect you and others around you, especially with a kid at home, it's important to make sure you get that shot. So did you want to go ahead and get that today?
Sure.
Alrighty. All right. So now that we have a little bit about your past medical history, I'm going to flow into a little bit of your family history, see where you come from, and what brought you up. And when I mean family, I mean your parents, your grandparents, your child, and any siblings you may have. So first off, are there any chronic diseases in your family?
My dad has diabetes,
Okay.
and my mom has high blood pressure.
Okay. And when did your dad get diagnosed with diabetes?
10 years ago.
10 years. Okay. And is he medicated for that?
Yeah, he takes a lot of medicine.
So it's well controlled?
Yeah.
Okay. All right. And your mom's high blood pressure, how old was she when she got diagnosed?
5 years ago.
5 years?
So, yeah.
And does she take medication?
Yeah, she takes one pill.
Okay. And so that's,
Yeah.
okay. Awesome. And have there been any early deaths in your family?
My grandma, she died of like a heart, like CHF,
Okay.
heart failure.
Okay. And how old was she when that happened?
She was like 55.
55. I'm sorry about that. Alrighty. Is there any history of alcohol abuse in your family?
One of my uncles.
And uncles? Okay. And any history of drug abuse?
My uncle.
Same uncle?
Yeah.
Okay. Alrighty. But no one else besides
No.
uncle? Okay. And has anyone in your family been diagnosed with any mental health issue?
My uncle.
Your uncle? Don't laugh. And so was he ever hospitalized for this issue?
No.
No? Okay.
Just put in jail.
Okay. All right. So now that I know a little bit more about your family history, I'm going to go over into your personal social history. So some of these questions may be a little personal, so
Okay.
if you feel at any point that you're too uncomfortable to answer something, go ahead and let me know, and I'll note it, and we'll just move on. But I do want to assure you, though, that these questions are strictly confidential, just between you and me, and it'll help me just be able to treat you better.
Okay.
So first off, do you smoke?
No.
Have you ever smoked?
No.
No? And so no other tobacco products either?
No.
Okay. And then do you drink
I mean, occasionally.
occasionally? How many drinks a week would you say?
A week? I mean, probably like 1 to 2.
1 to 2. And what do you drink mostly?
A glass of wine.
A wine? Okay. Alrighty. And then have you ever used any illicit drugs?
No.
No? Okay. And you said you had your 2 pregnancies. Have you ever had any chronic illnesses?
Me? No.
No. And are you currently sexually active?
Yes.
And do you use protection?
Yes.
Okay. All right. And sorry about that. All right, so now that I have a little bit more about your personal social history, I'm going to move into a few of yes or no questions. And these questions, it'll be a whole bunch of different ones about everything that's going on today, and hopefully nothing will connect to it, so that way there's nothing else bringing you in today.
Okay.
So first of all, are you having any appetite changes of any kind?
No.
No, or any weakness or fatigue?
No.
Okay. Any hair loss?
No.
Any visual changes?
No.
Sore throat of any kind?
No.
No? Alrighty. And are you having any problems with your shortness of breath?
No.
No? And any chest tightness?
No.
No? Okay. Any chest pain?
No.
Or palpitations?
No.
Alright. Any swelling that you've noticed or any circulation problems?
Mm-mm.
No? And any nausea, vomiting, constipation, bloating in your stomach?
No.
Okay. Do you have more urgency to urinate?
No.
No? And is there any blood in your urine?
No.
No? Alrighty. Any rashes of any sort that you've noticed?
No.
No? And any mold changes?
No.
Okay. Any vaginal discharge that's abnormal? Okay.
Nope.
Or pelvic pain?
Nope.
Okay. Any unexplained bleeding
No.
or clotting issues?
Mm-mm.
Okay. Have you had any muscle pain or stiffness
No.
or joint pain
No.
or weakness at all?
Mm-mm.
Okay. Any headaches?
No.
No headaches or seizures? Alrighty. Have you noticed any numbness or tingling
No.
or any mood changes of any sort?
No.
All right, awesome. All right. So now I'm going to go ahead and summarize a little bit from my last summary what is going on today. So you're coming in here, you had one surgery and it was a C-section and you were hospitalized with that, but other than that you didn't have any other hospitalizations. You are not allergic to any medications. Are you allergic to anything environmental besides, what does your seasonal allergy consist of?
And it's just that time of year,
You-
something
yeah.
in the air.
Okay. Okay, so you've never been tested for that?
No.
Okay. So you do take Claritin whenever it is around your seasonal allergy season. You are going to get your flu shot here today with us. And your dad has diabetes and your mom has high blood pressure, but both of those are really well controlled. And your grandma unfortunately passed away with heart failure when she was about 55. You're really great with your alcohol. You don't overdo it. Would you say that you're an active person?
Yeah.
So how often would you say you work out?
Probably 3 times a week for an hour.
Oh, awesome. Okay. And what does your typical diet look like?
I mean, I get up with my child and I make both of us eggs. We usually have sandwiches for lunch, and then I'll make like chicken and vegetables for dinner.
Okay. Awesome. That's wonderful. Keep that up. Keep your nutrition intake wonderful. So what do you do for a living?
I work in an accounting firm.
All right. Okay. All right. And you live at home, is it just you and your child?
Yeah.
Okay. And do you feel like you have a good support system around you, whether it's family or friends?
Oh yeah, my family lives like a mile away.
Okay, awesome. All right. So now that I have all this information, I'm going to go ahead and tell the doctor about it, and we'll come back and reassess you, all right? Does that sound good?
Sounds good.
Thank you so much for letting me talk to you.
Thank you.
Thank you.